to today's BC Support Unit webinar, which will be about an hour in length. You may have noticed that we've muted you as you joined the webinar to avoid background noise during the presentation. We encourage you to use the chat box function to share questions or a discussion at the end of the presentation. The chat box can be found in the top right area of your screen. It looks like a little dialog box, and if you click that, that will pop it open. At the end of the presentation, I'll unmute your microphone so you can participate in a discussion if you wish, or you can use the chat, whichever you prefer. This webinar is being recorded and will be available on our website, bcsupportunit.ca, under Resources, tab labeled Resources, so you can share it with your friends and colleagues. And after the webinar, you can expect to receive an online survey link sent to the email address you used to log in to this WebEx. We appreciate your taking a few moments to complete it, as your feedback helps us to plan and revise our webinar series. I will also be including the recording link in that email for you to share with others so it's easily accessible. And I think we are now at 1 minute after 12. I'll just say welcome from me. I'm Pat Atherton at the BC Support Unit offices at 1367 West Broadway. We have a small group of us tuning into this webinar, being delivered by Kim McGrail from her offices at the University of British Columbia in Vancouver. So over to you, Kim, please.
Great. Thanks, Pat, and thanks to everyone who is able to join today. We're happy finally to be able to make this presentation, which we've had to move around a bit because of our election and then the strange and ongoing interesting election results. So just by a little bit more introduction of myself, I'm Kim McGrail, and I'm an associate professor here at UBC in the School of Population Public Health and the Center for Health Services and Policy Research. But I'm also a scientific director of Population Data BC and data lead for the BC Support Unit, and it's really that, or those hats, that I'll be wearing and talking to you today. So what we want to do with this webinar is give you a bit of an introduction to the strategy for patient-oriented research and a small bit of an overview of the BC Support Unit. I really spend most of the time talking about the unit's data plan. I really just wanted to start with those other two pieces. For anybody who hasn't had an opportunity to hear about those things, it'll make more sense to talk about the data plan, ensuring that we have some kind of common understanding of where that plan fits in this broader initiative that we're involved in. And I say now that I think my comments will take 30 or 35 minutes. I certainly want to leave lots of time for questions and interactions with you because of course, this is all meant to be serving the broader research community. So what is a strategy for patient-oriented research? This is a signature initiative of the Canadian Institutes for Health Research, and SPORE, the SPORE family, is this, it's a coalition of partners that span the country who all have this a dedicated interest of bringing research and clinical care closer together, but also involving patients and public and patient voice into all pieces of that process. So there's these 5 elements of the strategy for patient-oriented research that we talk about. So one is support units, which I'll provide more information on in a minute. Another are SPORE networks, which are both formed around primary care and then around some specific diseases. And again, those are meant to be working across the country and trying to bring research to bear in particular areas in a patient-oriented way. There's an interest, or one of the elements is improving the clinical trials environment, so the supports that are available for clinical trials all the way from methods to data and software kinds of supports. Patient engagement is a key feature that runs through all of this, trying to bring, as I said, the patient and public voice to all of these processes, and training and capacity development, which you see, I think you can see relates to all of those other pieces. So in the world of support units, there's 10 SPORE-funded support units in Canada, and they are meant to be helping to support patient-oriented research. So before going any further, it's probably worth saying what I mean by patient-oriented research, and frankly, this is not saying just what I, Kim McGrail, means. It's how CIHR has defined it and how we're talking about this within the BC support unit. So this is research that's done in partnership with patients. It answers questions that matter to patients, and it aims to improve healthcare. So it's a very simple way of saying that this isn't just about patients as research subjects. It's about patients informing the questions that we're addressing and the conduct of the research itself, interpretation, knowledge translation, all parts of the whole process. So what's a support unit? And support in that is actually an acronym that I'm not going to try and recreate because I never get it right, but that's why it's all in capital letters. So the support units, as I've already said, are one of the 5 elements of the National Strategy for Patient-Oriented Research. And the idea of the support unit is really as an infrastructure investment that will help provide expertise for people to pursue patient-oriented research. And of course, what we want is research that will actually change the way we deliver healthcare and improve processes and outcomes for patients. The way that we formed the BC support unit is perhaps maybe a bit different from other provinces. We came at this with a very partner-oriented approach. And so in the end, we have many different organizations that are dedicated to partnering in this big endeavor to achieve all of the things that I've already talked about. So the partners that we have involved at this point include health authorities, universities, government, patients and caregivers, and of course research institutes and the SPORE networks and foundations and so on. So it is a fairly complex endeavor, but I guess my interpretation is if we want to do things differently, then this is what we need to do, is bring these partners together to work in a way that we haven't worked before. So just to give you an idea of the full landscape of partners that are involved, I'm not going to go through all of these one by one, but you can see this, it involves many, many different agencies, organizations, and interests across the landscape of healthcare service research and delivery in British Columbia. And so the BC support unit specifically, our goals, we have 3 of them, are to build capacity to conduct and implement high-quality patient-oriented research in all regions of BC. So this is very decidedly not meant to be a lower mainland phenomenon. It is meant to reach everywhere. We want to increase the quality and impact of patient-oriented research across BC, and we want to ensure there's ongoing support for patient-oriented research in all regions of BC. In other words, that we really want to make this a sustainable new way of doing things, not just a temporary something that's happening while there is this infrastructure build funding in place. So how are we going to do this? This provides a bit of a schematic overview of what the support unit is and the component pieces that are fitting together to try to achieve the goals I've outlined. So one piece of this is that there's an overall governance, which is provided to us by the Academic Health Sciences Network, which some of you will have heard of. It itself is a newly developing organization, and the board of the AHSN is the board for the support unit. Under that, we have a provincial office, and then the provincial office serves as a hub or as a regional center for the Vancouver area, and then in addition to that, we have regional centers in the other 4 regional geographic health authorities in the province of Interior, Fraser, and Northern and Island. So all areas of the province have a physical presence of the support unit, as well as this being, of course, a largely virtual sort of enterprise. And it's really the regional centers, including the Vancouver Regional Center, through which people will first make contact and request for services through the support unit. In addition to that, there's this, the little thing that looks a bit like a Ferris wheel, I keep thinking, is this idea of methods clusters. And really, this is a unique aspect of our BC support unit. This is not something that we modeled after other provinces, but the idea is that we have the opportunity to build a community of methodology practice around specific areas where we think that there's room for the development of better methods to support patient-oriented research. So the methods clusters that we have getting off the ground now are in knowledge translation, implementation science, in health economics and simulation, in data sciences, and just getting underway with patient engagement. So these are areas where we think that there's good, sound methods now, but that there are additional things that we probably need to develop and actually execute in a methodologically rigorous way to push the area of patient-oriented research forward. And then the last piece, the spaceship kind of piece on the lower right corner of this diagram, really refers to a provincial data platform, which I would like you to really interpret as both a platform of data, but also a whole lot of surrounding services that help us make good use and efficient and effective use of those data services. And so I'll take the opportunity of talking about actually what's now called the health data platform rather than provincial data platform. I'll give you a little, something didn't happen right here with my slides. Okay. I'm actually going to, pardon me for doing this on here, but I'm going to go forward to the health data platform to give you a little digression on what the health data platform is all about. So what this really is, if we think of the health data platform is being developed by the Ministry of Health in partnership in some aspects with the support unit, but the health data platform itself is a larger endeavor than the support unit, just the way that the support unit is a larger endeavor than health data platform. So if you think about Venn diagram, there's some intersecting activity here. The general idea of the health data platform is that it provides both a physical and a technical place for the sharing of data and the linking and integration of data. So if we think about this as like a lot of underlying activities that we won't see on a project-by-project basis when we're trying to execute research, but it's a way of organizing things so that it makes things more efficient and fast. And the idea is that for researchers, the entry point to the health data platform will be through Population Data BC. So that's why the door there on the bottom, researchers will go through that. So what the health data platform is helping, as I said, helping to fund this and to facilitate access to the health data platform. The Ministry of Health is taking the lead on a lot of the additional technical components that are not actually funded by the support unit. And as I said, we'll have one door into that. So that's just a little digression, because I know that ends up being quite a lot of conversation around what's the distinction between health data platform and what the other pieces of data work that we're doing within the unit. Regional centers, I think I already covered those. We'll go on to, so the patients as partners here. So patients are represented in many different ways in the support unit, and we're frankly still working on all of the appropriate ways to bring patient voices in and all the different mechanisms that we can use. So for example, we have patient representatives on the Academic Health Sciences Network Board. That's the governance authority for the unit. We've recently formed a patient council for the support unit, which is a group of 15 patients who are going to provide a voice and advice to us, and also are likely to get involved in some of the specific projects that we're undertaking within the unit. And we've integrated patients into many of our unit operations, including being involved in hiring interviews, for example, for the methods clusters, and in training sessions for all of us. Part of this is being executed through Patient Voices Network, which we're very lucky in BC to have such a great organization to help us recruit and train and find patients who are wanting to be involved with the unit. Okay, so the goal of the data area of the unit, so now for the rest of the presentation, I'm really going to focus just on the data piece of the unit. And we have developed a data goal that really is pretty straightforward. It's to increase the availability and utility of data and related services to support high-quality patient-oriented research, including clinical trials. So again, we're really emphasizing what people can do with the data, not just emphasizing the technical structures themselves. We see a lot of opportunities at this point in time in developing a data area of the support unit. And part of this is related to things that I've already been talking about a bit. So one is that there does seem in British Columbia to be a strong commitment to transformative change. This is both in the health sector and in the government approach to data overall, as evidenced in the March announcement by the Premier of a Center for Data-Driven Innovation. So there's a just a general commitment that government is interested in seeing data that's already been collected used for multiple purposes. So that's a good thing for us to be able to build on. There's also large-scale initiatives that have similar overlapping objectives that we've actually drawn into the support unit to some degree. So, for example, the Clinical Systems Transformation Initiative that's building and implementing a new complex EMR system, electronic medical record system, in the Lower Mainland, and particularly in Vancouver Coastal, Providence, and PHSA. So we're partnering with that in the unit, but again, it represents an investment that relates to the organization and availability of data. I've already talked about building of the health data platform that the Ministry of Health was committed to even outside of the unit, so the fact that we can leverage some of that within the unit is a really good thing. And of course, the fact that we have support units across Canada means that we can learn from what others are doing. It's just another way to build a collective intelligence, both by doing some things the same way and, frankly, by allowing some provincial differences and then learning from those provincial differences about what's working and not working. I will say as well that there's some similar international initiatives, particularly in Australia and in the United Kingdom, that we are paying attention to and learning from and thinking about when we're thinking about services and the kinds of data infrastructure we want to build and offer. So who's involved in the development of the data area of the support unit? There's 8 of partners to the support unit from that large chart that I showed you. These are the 8 that are really very specifically involved. Lots of others will have some interest in data and so on, but these are the partners that are formally helping to drive this agenda forward. What we've done over the past 8 months or so is we formed a data advisory committee that has membership that includes at least one representative from each of these partners. And then we work together in that data advisory committee to talk about all the projects that each of us is interested in doing, to bring those together into an overall set of what I'll show you as 7 objectives for the data area. And then we're using now the data advisory committee to make sure that we all understand what's happening, who is in charge of what, and to make sure that what we're developing meets the needs of our research community in BC, that we're as efficient as we possibly can in the use of dollars, and that we're really using each other's expertise in trying to make all of these things happen. So just to go quickly around the circle here to tell you who's involved, I've already mentioned the Clinical and Systems Transformation Project, so that's that partnership between Vancouver Coastal, Providence Healthcare, and the Provincial Health Services Authority to implement a new electronic medical record system in the hospital environment specifically, but hopefully be drawing in some other data sources as well. Another partner is CHAOS, the Center for Health Evaluation and Outcome Sciences, based at St. Paul's Hospital, who has the expertise they're specifically bringing, although we will benefit from a lot of expertise that CHAOS has, but the specific area that they're working on is clinical trials and supports for clinical trials, including software supports. Island Health is involved as well, specifically in a research area. So in addition to having a regional center at Island, on the island through Island Health and the University of Victoria, this is a separate data-specific involvement for them. Population Data BC is the data lead for all of this development. Ministry of Health is a major partner in the data area, as is the Center for Clinical Epidemiology and Evaluation, and they have specific expertise in both the offering of primary care research data collection, but also in a lot of the methods that people will be using in the support unit. There's a BC Children's Hospital Research Institute is involved. For some of who don't know, this is what was formerly called the Child and Family Research Institute, or CFRI. And then we have a very specific and special area around patient-reported experience measures and patient-reported outcomes measures that is part of this data area. So those are the partners that are working together to bring all of this together. So like I said, there's 7 objectives, and what I'm going to do is walk through each of those 7 objectives. So objective 1 is this shared technical policy and process standards, and we need these standards to make sure that they comply with all the legislative and regulatory requirements that we have in British Columbia. But essentially, really, this is about coordinating, building, and operating a data system. So this is all the technical underpinnings that allow us to link data, to move data from one place to another, that we're sure we have good storage solutions for this, that we actually start to think about metadata definitions and so on. So really this is I kind of maybe would say a parallel to this would be like the wiring for electricity that sits in your walls at home. You don't think about it too much, but you really need that to make sure that it's working well. And you think about the bottom right corner of this, what we really also want to do with this is to streamline the way that we're doing things so that our success can be more of that straight line through this complex maze, as opposed to having to run around in the circular way that we often do now in order to get data and bring them together for research purposes. Okay, so that's where that data platform, the health data platform, really fits, is in building that kind of underpinning technical structure. So the second data objective really then is about improving the speed and transparency of research data access. So this is really, in the first objective, what we're talking about is building recommendations about streamlining and building the technical infrastructure that can support that. Here's where we really want to implement it. And perhaps this reference is getting too old, but it's the old Jean-Luc Picard Star Trek, make it so kind of thing. This is where we really want to hopefully convince data stewards that we can recommend a streamlined approach to getting data out faster to researchers. And this would include the potential for access to data aggregates and process data, indicators, and so on, so that we're not necessarily always just starting from the raw data, and that we can get things to people in a timely manner. So related to getting things to people faster, we also do want to, in this third objective, broaden the array of available data. And so if you look at the kind of rectangular piece of information here, this is really the really strong base on which we're building. So we already have in British Columbia a lot of really great administrative data that we can link together for research purposes, and that comes from the healthcare sector. But we are broadened out well beyond the healthcare sector to early childhood, to demographics and life force, which includes the Canadian Partnership for Tomorrow project, the BC Generation Study that has physical measures as well as survey results. We have occupational information from workers' compensation, for example. We have vital statistics, births and deaths information. So we have this incredibly strong base of information that researchers can get access to, and objective 2 is about making that more streamlined. But in this objective, we also want to be able to really use this as a starting point and bring in even more data. So I mentioned the patient-reported outcomes and experience area. This is one major piece of development. In BC, we've actually been collecting patient-reported experience measures for well over a decade. And those have been collected in acute care, in the emergency department, and in long-term care, both from long-term care residents and by their most common or most involved informal caregiver. So there's an enormous amount of information, but that information generally has not been available to researchers, and it has not, to this point, been linked to any of these other data sources. And so that's one of the things that we're going to be working on and building, is that ability to access those data for research, but also to be able to link them, which will really, frankly, be a very unique resource that I hope people will be thinking about how we might be able to use that to help understand our delivery system and ways to improve it. We're also going to be, well, we are well into working on systems to help researchers conduct primary data collection in a very privacy-sensitive way. So this is, in the first instance at least, we'll be rolling out a REDCap system that will be available for patient-oriented research across the province. And then we're also working on bringing electronic medical records and the information stored in electronic medical records and making them more available for research. So part of this will be through the Clinical Systems Transformation Project and those EMRs through hospital and other kinds of services. We also have a different stream of work that's focusing on primary care electronic medical records and bringing that information and making it more available for research purposes. So there's lots of activity in this area, and I think some pretty exciting things that continue to make BC quite unique. So I touched on this in the context of thinking about broader access to data. So the objective 4 is the primary privacy-sensitive primary data collection and use. And really, this is an area where this is really simply meant as a service. So we know that researchers are wanting to do collection of survey information, or maybe they're managing even a database for research projects of some other variety. Well, this is something that we can set up and provide as infrastructure support so that researchers don't have to do this one by one, which can be quite inefficient use of resources. Objective 5 is greater efficiency and quality of database resources, and this is where I would say part of what we're trying to think about is reusing and not forcing people to start at the bottom of a learning curve or at the bottom of a sine curve, if you think about in that way, at the start of every project. So this is about sharing in one way or another, whether it's a reusable analytic or a macro from a SAS program or some other kind of software that you've figured out how to measure continuity of care, for example, in a primary care setting. How do we share that so other people can take what you've developed and maybe advance it even further rather than starting from scratch again? Another of these areas you would have heard Minister Lake, when we opened the support unit last November, talk about BC Data Scout, which will be a way for people to just make a very simple request to find out if there's enough sample size of people who have a particular condition who've received a particular kind of service to pursue a research question of interest. So those are the kinds of things that we'll be pursuing here. So it would involve metadata and other things like that as well. The 6th objective is providing data-related supports for patient-oriented clinical trials. And I've already mentioned this a couple times. I guess the only thing I would add here, we tend to think about clinical trials as trials of a new surgical intervention or a drug, but you can see from the cartoon that is included on this slide, we're really thinking about pragmatic trials as well, or real-world trials, or trials that are happening in primary care. So this is broadly defined, this notion of trial, and it really trying to bring the experimental approach of trials to a much broader variety of research. And again, this is a way of improving the quality of research if we can borrow some of those higher level methods to some of the other things that we're doing when we're testing new things in the healthcare system. And then the 7th objective really is to make sure that we do continue to learn from others and that we also raise our own profile. BC is a really interesting and innovative place to do research. I think this is maybe a particularly Canadian thing that we don't necessarily always brag about what we're doing well, and I think we do need to do that as long as we're doing it soundly based on evidence that we know we are actually doing things well. And we're thinking about a learning health system. I know that a lot of people talk in circles and loops and PDSA cycles, and I guess in the end I'm really captivated by those, but I want to make sure that we see ourselves moving forward. So it's not just a circle going around and around, but we're going around a circle that's somehow moving us in a direction of learning. So that's really what I wanted to make sure that you heard about the data plan. I would really love for any email thoughts you have on services we should be offering or things we need to be considering in developing the data area. Of course, you can sign up for our newsletters, follow us on Twitter, but at this point, I would just open it for questions and any comments or discussion you would like to raise. Thank you.
Thanks, Kim. I've unmuted all participants now. I'm going to mute a couple that I feel might be making some background noise. But if you have questions, you're welcome to pose them either through your audio or through the chat function. You'll find the chat function in the top right-hand corner of your screen, a little icon that looks like a dialog box. So with that, are there any questions for Kim?
Kim, I have one. It's Kent here. We are well known to each other, and I wanted to take this opportunity to hear your overview of your plan for the data section of the support units. And thank you for your kind acknowledgement of the patient partners in the support unit. But based on what you've described, you've talked about how part of the role of the data section will be to improve the accessibility and comprehensibility of data generally, but in terms of your efforts to improve the diversity of data that's available, do you have any plan to attempt to capture data that's not being captured now? And a specific example that I have in mind is under the compassionate use exemptions that Health Canada allows for drugs under development that might be a treatment of last resort for people with rare conditions, etc. No one is now capturing those outcome measures, positively or negatively, patient-reported or otherwise, of those compassionate use cases. Does the support unit have any plan, or had you given any thought to attempting to improve or begin the capture of that particular data?
Thanks for the question, Kent. And it's an interesting one. I guess I have two different ways of answering that. One, on the specific question about compassionate uses of drugs or other kinds of interventions, no, there's not anything specifically planned for that. I guess I would see that as potentially coming, if somebody wanted to do a research project around that, that would be a way to get those data in, but kind of going forward with a specific desire to get those, I think it would probably have to be driven by a particular need from a researcher. But then I can move to the more generic answer to your question, or an answer to a more generic question, which is about the different types of data we might want to bring in. And I guess I want to convey two things. One is absolute openness to be driven by researcher priorities. So if researchers are interested in something that it has a patient-oriented flavor to it and really need an additional set of data that you don't think exists, that's the kind of thing I'm happy to talk to researchers about to see if we can meet that need. But the other thing is we're very attentive to actually doing primary data collection of things that might be interesting. So for example, there's a really interesting project from the UK that used essentially citizen science or crowdsourcing type methods to try to look at the relationship between rheumatoid arthritis, pain, experience on a daily basis, and weather patterns in specific areas. So this was done through a mobile phone app that on a daily basis, patients involved in this research project were entering like a scale for how they were feeling that day. And if that's the sort of thing I would love to be able to support if there's enough research interest in that kind of data collection that it would make sense for the unit to go in that direction. So sorry, a little bit long-winded, but it's a really interesting question.
Thank you so much.
Thank you, Ken. Other questions for Ken, please?
Hi, it's Jim Christensen. Can you hear me? Yeah, Ken, thanks very much. It's very exciting, but of course, the devil may be in the actual processes and the details of how we do this kind of thing. So I'm very interested in what the change might be in the approach to privacy assessment and whether it truly will end up to be something where there are sort of pre-approvals because of the way the data is structured and the way it's accessed, will actually contain those controls, and it won't be individual researchers trying to actually go through privacy assessments when we're trying to other linked databases or get other information from patients and load it somewhere, which, I mean, I'd be very happy from our registries, for instance, to be able to put that information in cardiac arrest into this data cauldron or whatever it might be so that we can actually do. So we're going through a process right now to do that, and it's, I think it's reasonable, but I'm hoping that it'll be a little slicker in the future, and particularly from the privacy, but also from the ability to actually link in and explore, I guess, as opposed to maybe asking specific questions that need specific privacy assessment, and then you can only do that, answer those questions, and then you start again if you want to ask another question.
Yeah, Jim, thank you for that. And of course, you've embedded several things in that as well. I just have to say I love the idea of a data cauldron. Maybe it has a slight Macbeth kind of thing to it. So one of the projects that we have going right now, and it's being led by Shirley Wong, who's also leading the development of the Health Data Platform within the Ministry of Health, and that's the streamlining project. So this is really about trying to organize differently the processes when people are asking for data that cuts across organizations within the health sector. So this is not just if you want BCH data, but maybe you want something from the Ministry of Health, plus some additional detail from Interior, or you want data from 3 different health authorities, or whatever it might be. So we're trying to streamline those processes. And absolutely, we have talked about one possibility of having some things that are set aside as pre-approved. So if you want access to X, Y, or Z, and it's in the pre-approved bucket, your process would be faster. I don't want to overpromise. Those decisions aren't made, but it's absolutely on the table as one possibility. And that's something you should be seeing over the next few weeks. We'll be doing some consultations with possible different models for this with the research community. So if anybody's interested in being part of that, we'll want to know that. So that's one piece of things. I do hope that we can make linking easier, partly through the streamlining process and partly just by being a little bit more transparent about what's required. If you're bringing, for example, a new data set in to be linked, so that's another way to help. And then I think maybe I'm going to guess at some of your purposes, Jim, but it's something I didn't highlight specifically, but one of the other projects we're working on is something called the Direct Access Project. And what this is developing POP Data's ability to go into Ministry of Health holdings and pull data out. And what that means is that when we pull data, they should be a lot more close in time to real time. So we don't have to wait for the end of fiscal years and so on for files to be closed. I'm hoping that this will help for some of the follow-up, where follow-up is to be timely. So, Jim, I'm thinking, for example, about your emergency medicine network projects. And we should be able to get data out that's far more timely than we've ever been able to provide in the past.
That would be wonderful. Thanks very much.
Thanks, Jim. Kim, we have a question from through the chat feature. The question is, you've talked about the partnerships established. What seems to be missing from that with the universities? Where and how do you see them fitting?
Yeah, the universities are part of or will be partners in the overall academic health sciences network. So in that way, I absolutely see them as integral to the BC support unit. I guess the more direct way for universities to be involved in the data area will be through the university-based researchers who want to use these services and might help guide what some of our priorities should be over the rest of the 5 years. We're 1 year into this a 5-year development phase for this unit, and we are going to want priorities and things coming through from university-based researchers to help kind of formulate what the next big thing should be after we get the current things well underway.
Thanks, Kim. Other questions from our participants on today's webinar? Any from here on West Broadway? No.
Hi, my name is Jamie. I'm from Trauma Services BC. And I have a question around using this data for non-research quality improvement. So organizations like us or cardiac services or others that want to use data on, for example, patient-reported outcomes to assess indicators on a regular basis as opposed to a one-off basis on a research project to, test the validity of an idea. Is this a possibility using this data set?
I would certainly hope so. It has been long in my mind. Two different things that I think your question raises. One is access for people who are maybe not pursuing pure, quote-unquote, operational questions, but are also not necessarily academically based researchers, at least in the majority of their life, and I think we need to find a way to serve that community. I think another thing your question raises is to what extent do people need access to information that's not necessarily at the level of raw, unprocessed data. So if you want indicators for, as you're describing, routine follow-up or tracking of some event or something in the healthcare system, I think we absolutely, I hope that we can find ways to support that. So I'm building a little sort of case study, so if you would be willing to talk with me afterwards, maybe I can just document that as just another example of where there are needs that are not currently being met.
Wonderful, yeah. I'll shoot you an email. Yeah, we're very interested in that because once we've proven an idea or there's a research paper done on patient-reported outcomes for trauma, because right now our only measures are mortality or length of stay or complications, which aren't great. They're very blunt instruments in assessing whether clinical care in a site or a system has made a big degree of effort in the patient's life. We then want to track it so that if we're improving the system, we should see results in that those outcomes improve year after year. So yeah, I'll definitely shoot you an email afterwards.
Great, sounds great.
Great, thanks for the question. Stephanie, I think you were trying to ask something, were you?
It's Diane Sawchuk in Island Health. I was going to ask a question if I could.
Sure, go ahead, Diane.
Thank you so much, Kim. You made reference to the clinical systems transformations, and I heard involvement of Vancouver Coastal PHSA Providence, and I'm just wondering what the connection is with the other health authorities, Interior Health, Northern, Fraser, and Island Health, in terms of plans in the future for consistency of data fields across electronic medical records and electronic health systems.
Yeah, that's such a great question. And the focus on Vancouver Coastal Providence and PHSA comes because that's where the funding is for this particular EMR implementation. Is that's not a support unit decision. That's the way things are rolling out in that much larger project. Having said that, I absolutely hear you that we need to be thinking about integration of these systems across the entirety of the province, which of course doesn't mean that everybody has to be using the same EMR. It means that we need to be thinking about how we're going to draw information out of EMRs to make it consistent, even where those, so in a platform independent kind of way. Now, having said that, Island Health already has a Cerner implementation, which is what this CST project is doing. It's a Cerner implementation, so there is already some potential to be consistent there. And then when I mentioned the streamlining project, which is in part about trying to at least form the access processes for these disparate data, we have included people from outside of those. So we have people from all of the health authorities involved in that. So as much as I can, we're trying to make sure that those conversations will extend beyond the particular projects as they are. As you would imagine, in a complex EMR implementation, that's a lot easier said than done. But I absolutely understand the point you're making and agree that it's really important to try to keep an eye on that and make as much difference as we can to ensure that the data will be comparable.
Okay, thank you.
Thanks for the question. Kim, there's a question through the chat function where you're being asked about REDCap and how an individual might access that service.
So what we have not rolled out the REDCap service yet, but the way that we're thinking about it right now, and it should be relatively soon, a matter of weeks to months, not months to years. We're thinking about two different things. So one, because this is the support unit, really it need to be focusing on serving projects that have a patient-oriented component to them. So that's the sort of initial eligibility for the service through the support unit. And then there's a second layer, which is going to be more, do your needs map well to what REDCap can offer? So if you were proposing to use REDCap, for example, for an FDA-regulated clinical trial, it's probably not the right tool for the job. So there's a layer of that, just to make sure that REDCap can do what you need it to do. If it can, then what will happen is you'll go through the support unit, get connected to a REDCap service provider, and they'll work with you to help implement whatever it is you need to do. So there's still some details to be worked out, but that's generally the way we're talking about it right now.
Great. Thanks, Kim. Other questions from our participants today? We have one in the chat function, Kim, about the complex slide that shows all the partner organizations. Questions about whether the FNHA is represented.
Oh, I'll go back and see if we're specifically on there. I know several parts of the unit have had conversations with First Nations Health Authority, and it is, oh yes, yes, you can see in the sort of central lower area it's there. So that relationship is still developing, but for sure it's part of our landscape.
Thanks, Kim. Other questions from our participants today? Anything else from anyone?
Hi. Hello.
Hi.
This is Mila from the Renal Agency, and I have a question for Kim. It's about the objective 5 of having a greater efficiency and quality for the.
Sorry, Mila, it's difficult to hear you. If you could speak a little bit louder, please.
Can you hear me louder now?
Yes, thank you.
Okay. This is Mila from BC Renal Agency, and I have a question about objective 5 of improving the quality and just efficiency for the database research. So for the BC support unit, what activities would be done for this objective? Within BC Renal Agency, we've been talking to different agencies on our own, just to share the experiences and what other agencies are doing for data sharing and data linkages. So I'm interested in what type of activities would help some of this knowledge exchange.
It's a great question, Mila, and I'll be very honest. Because it's a 5-year project, and what we've been working on is developing our broad objectives, but not trying to develop every project underneath those, because we fully recognize that we might design something in 2017 that by the time we get to 2019, when we're still in this project, isn't going to make sense anymore because technology has changed or interests have changed and so on. So we know that this is an area of interest. It's not fully scoped, so if this is something that you have been thinking about, I would value at some point in the future conversation about what you would see as priorities and so on. What we do know is that, for example, I talked very briefly about the BC Data Scout, which, as I said, was announced by Minister Lake last November. That's on the front end of research. We know that there's a very strong need for really good metadata, so we know that we'll work on that, and we know that there's a need for usable analytics. But how we're going to make that happen, what indicators we might need to develop that we just want to make available on a routine basis, that's very much open. This project is not fully formed. So I would actually welcome your input on this.
Thanks. Looking forward to having more of those conversations.
Thanks for the input, Mila. Other comments or questions from our participants today? Any other questions? If you have a question, you might be muted. I see about half of our audience is muted, so if you have a question, you might unmute yourself if you're trying to pose it and you're not hearing the response. Well, hearing none then, Kim, I think this concludes our webinar. Do you have any final words you'd like to share with the participants?
Nothing other than thank you for taking the time for this, and really please don't be shy about getting in touch and letting us know what you're thinking and what you really need to do the research you want to do.
Well, thanks very much, Kim. We appreciate you taking time out of your busy academic day to present today's webinar to all of us. So thank you very much for that on behalf of everyone here at the BC Support Unit. We'd also like to thank all participants who took time out of their day and gave up their lunch hour to join us and learn a little bit about the provincial data plan. So thank you for that. As I mentioned earlier, you might receive an online survey link after this webinar. And if you do, and if you have a few minutes, we'd appreciate you taking a moment to complete that survey to help us improve our delivery. As Kim mentioned, we are a learning organization, and we'd like to learn from what you thought about today's webinar. You'll also receive a link to the recording of today's webinar in that email, so you can share that with your friends and colleagues. We encourage you to do so. The recording will be up on our website under the Resources tab on the home page. So with that, I thank you very much for your participation today, and we look forward to seeing you at future webinars being hosted by the BC Support Unit. Thank you very much.